everyone. Thank you so much for coming out tonight. Looking forward to hearing our discussion tonight, and a little bit of background here. So the format will be, there'll be a panel discussion. Juan is our moderator, and in a minute I'll let these ladies introduce themselves. The panel discussion will last about 45 minutes, at which time we'll go into a question and answer period. During that question and answer period, I'll stand up here and look like I'm important and direct questions, and the panel will respond to those. So without further ado, Wanda, if you would introduce yourself.
Sure. Well, good evening, everyone. I'm Dr. Wanda Hall-Myers. I am a psychologist and owner of Hall-Myers Consulting, where we help individuals and organizations successfully change while prioritizing their mental health. I also work as a behavioral health consultant in a primary care setting, providing brief interventions to patients who present just with a variety of concerns, and also providing consultations and support to staff and medical providers as part of the healthcare team. And now we will introduce our other panelists. First we have Dr. Laura Schultz. Go right ahead. Yes.
I'm Laura. I am the Senior Director for Behavioral Health at Methodist Le Bonheur Healthcare. And my role there, I work as a clinical psychologist and health psychologist, in addition to leading our team of providers who are integrating into our medical practices. The majority of our providers work in primary care, both on the adult and pediatric side. But we do also have providers embedded in our oncology and sickle cell practices, as well as some of our employer-based wellness clinics, serving Shelby County school staff, Germantown Municipal School staff, and the students at Christian Brothers University. So we are seeking to integrate behavioral health into the healthcare settings, both to support our patients and to take a little bit of the load off of our medical colleagues. So that is my role.
And next we have Ms. Janet Sellers.
Yes, so my name is Janet Sellers. I am the manager of our Staff Resilience Center at St. Jude. So I am a licensed clinical social worker, and in addition to myself, I work alongside a chaplain as well as a golden retriever. We have a staff facility dog, and so between the two people and our dog, our role is to support the staff at St. Jude. And so we do that in a number of different ways, which I'll talk about. Our clinical staff, research staff, admin teams. I think that our role is very important to help normalize that support is needed, that resilience is needed, and we want to make that really accessible to people and a part of just their everyday work.
Thank you. So tonight we've been asked to spend some time talking and discussing strategies that are sustainable, that will help to support well-being and also resilience in healthcare professionals. When we know that burnout is a huge problem and a very common problem, I saw some literature that suggests that almost half, up to 49% is what I've seen, of healthcare professionals, they experience burnout. So we know that this is a very serious problem because it affects not only that professional as an individual, but also the patients that they care for and those others who are in their circle. And so one of the questions that we want to spend a little time addressing is really to look at what role does leadership have in addressing burnout and also in addressing wellness? What's the role of leadership there?
Are you starting off on answering?
Well, I want to make this comment that we know the highest office, the office of presidency, especially really, I think this started before COVID, but during COVID there had been some legislation put into place, some programs put into place to really heighten the awareness of mental health and those concerns, and that was also backed up with some funds for that purpose. So we know that this is important, and so my response to this is in part that it is the responsibility of leadership. Leadership is at the top, and people often follow the lead of those who have been placed in authority over them. So I do think it is something that leadership must take on.
I would agree. I think that the role of the leader, we can't care for our patients if we aren't caring for our staff and the people who are doing the service. I was driving here tonight and I called a friend who's a physician and I said, "How was your day?" And she said, "Well, I had an emergency C-section with a baby. I don't know if they're gonna make it. And I had to tell a mom that her baby at 36 weeks on the ultrasound was deceased. And that same mom lost her last baby at 10 days old. So it was a hard day." I said, "Whoa, how are you caring for yourself in the middle of that?" And I think so many of our healthcare workers are doing hard things every single day, trauma, and we expect them to just get back up and do it again tomorrow without giving them any space to really process what they're experiencing and the fact that that hits them as humans as well. And so I really think one of the core things of leadership is that we have to be mindful. We have to be mindful that the staff members that we're serving are not robots, they're people. And they hurt when the patients they care about hurt. And we have to give them space for that and create an opportunity for them to say, "I'm not really okay." And then we have to have a plan and some resources to help support them in that. So I would say number one role of leadership is to be aware and mindful that the work we're asking our team members to do is hard. And number two is to ask, "How are you?" and create space for that instead of just drilling on their metrics and their performance and how are you doing locking your charts? Well, maybe I'm a little late because I had to say some really hard stuff to patients last night and I needed a minute. And we need to be mindful of that and give room.
I would also add, I came across something from the AMA recently that said that burnout manifests in the individual, but it originates in the system. And so I think part of modeling and making space, you have to look at, okay, what are we doing that we might be able to, modify? Or what are we doing to help support our individuals over time, right? Because while burnout may be something that I experience, if I'm working in a culture, in an environment where it's going to continue being that oppressive force for me, that's when people leave, that's when they don't stay in their profession. And when you work so hard to become accomplished and to do great work, we want people to stay in that field and continue to do that great work. We know that we need nurses, we know that we need professionals, we know that we need more healthcare providers. So I think we also have to look at the system and how we're set up to create the space or provide the resources and just meet people where they are. I think your point of asking people, "How are you?" and meaning it, right? It's not just a box that we check and say, "Oh, well, I asked them how they're doing, done with that." But listening and investing, recognizing, like you said, that people are not robots and so they have real feelings. And sometimes talking about feelings is uncomfortable. Sometimes asking the question is hard to do. But we do hard things all the time. And so it's important to continue doing those hard things.
And then to respond when they tell you they're not okay and to maybe make some changes. What can I do to support you in this role? That is a question that I strive to ask my team members at least once a month. What can I do to better support you as you're serving others? And maybe it's, I had a team member say, "I just get so frustrated with the EHR because I can't see who's checking in while I'm trying to do my notes and I'm constantly toggling back and forth." What about a second screen? We get her a second screen that didn't cost us that much, and she said it changed her life because she could actually chart and not be anxious about missing a patient checking in. So those little things that we can do to make workflow easier, to take some of that stress off, listening and responding to our people, validating where they are, and then actually doing something about it, I think is so important.
So it sounds like there are some things that we can do at the individual level. You've highlighted that very well. And also some things that would need to be done at the organizational level as well, right? We do know that as we offer resources or programs like wellness programs to an individual, if the culture of the organization is not changing, policies, procedures, those sort of things, it's not as effective, right? You know, if the individual is changing, but yet the environment that they're working in is still toxic, or there's still lots of problems there. So really, both of those areas, we should take a look at finding ways to try to address those. Okay, thank you, ladies.
Yeah.
So one other thing that I'm thinking about is, as we continue to talk about burnout, we know that burnout is often caused by a number of things, and we can talk about some of those areas. But one area in particular centers around the administrative burden. And you touched on this when you mentioned, you know, unlock charts. You know, I need to try to reach metrics. I have the paperwork that needs to be completed. But what are some ways, what could be helpful as a leader for us to address that within the organization? And so the question is, how can the healthcare organization reduce this burden and make room for clinicians to operate at the top of their game? And some of what we've already discussed and what has already been brought out is really important. You know, even looking at the technology and determining, is there a way to maximize the use of the technology so that it's more efficient, right? So that's one way in which we can look at reducing that burden. We've heard workflow, you know, really taking a look at what's working, what's not working, what's impeding the provider's ability to really be able to work well and work efficiently while they're in the space. So those are a couple of things to think about, but I would love to hear your thoughts on that before I come back.
Yeah, I think no healthcare workers get into our work because we love paperwork and documentation. Most of us are in it because we love patient care, and we realize we have to do the other things as a part of that to provide good patient care and communicate well with other team members. But are there ways we can help with that documentation burden? That is something that I'm constantly thinking about and looking at. And as my health system is making an EHR transition very soon, that's something that we're talking about constantly. How can we refine and streamline our documentation process? I recently met another colleague in a different part of the country who shared with me about these AI dots that they have in their exam rooms, and when they walk out of the room, the providers have like 80% of their documentation done. Amazing. So of course I sent the video up our chain of command, and I'm amazed, and that would, you know, I sent it to another colleague who said this would change my life, and I'm like, it would. So really thinking through, can we leverage things that are maybe new and cutting edge to help take some of that burden off of our providers? I think that is very important for us to be constantly considering and thinking about, and learning from others around the country how we can do it better. Another practical thing is staffing ratios. You know, I hear that constantly, and how to also keep staff, like, you know, our MAs and our front desk staff, when they turn over frequently, that creates an additional burden for our healthcare providers as well. It also changes the culture in the office and doesn't make it, you know, as cohesive and happy of a place to be. So I think really working towards hiring well, training appropriately, retaining our staff, making sure we're considering our staffing ratios as best as possible. All of those things are operational, but they have a huge effect on burnout and satisfaction, because if we're not staffed well, our providers and our nurses, our higher level folks end up taking on more administrative burden. And that's something that we can do in administration to really think through how we can best support them as staff appropriately.
We talked earlier about asking people, how are you? I think as you identify these pain points, right? What is slowing you down? What is an administrative burden, right? What is something that you feel is not efficient? Also asking, what ideas do you have about this, right? We can't always provide all of the solutions that someone else might think of, but sometimes asking the question, other people can identify and see things that we can't, or that we're not aware of. I was at a conference recently, and someone was talking about nurses who were having to put in the doctor's orders And so it slowed them down from actually providing the care because they were at the computer doing all of the orders. And so if that work could be reassigned to someone else, then the order would already be in. I know that I worked with one of our departments recently and was sitting in on a really good discussion that they were having about processes and what's working, what's not. And in the room, there were physicians, there were nurses, there were pharmacists, all talking about, okay, what's working? Well, this didn't make sense to me. Okay, well, let's talk about it now. And so coming together in that multidisciplinary group to problem solve and hear one another and have those discussions, as you identify those pain points, then you can help implement strategies that might change. And I think it's specific to every institution, right? It might even be specific to different units or different departments, right? What is going to work best with the resources that you have available to you to do the job that you need to do? And so it's really having those discussions and listening to what people say, what they think, not promising that you can do everything, right? Because we're not a genie in a bottle, but really getting their input, because I think that helps then implement solutions, right? Feeling like you're a part of it, feeling like you have feedback to share or insight, ideas, helps with buy-in when you're looking at addressing things and changing things. I will think about you as you're transitioning to a new EMR.
Thank you.
That's a big undertaking.
Thank you.
And I think that collaborative approach that you talked about is so very important for not just the leaders to be the only ones making the decisions that will impact the people who will actually be implementing a lot of those changes, but to have that dialogue, to have those conversations with other people who will actually be involved with implementing the change is so very important. I'm glad that you brought that up. I do want to mention, you talked about workload, and we see this often in the literature, especially as it relates to burnout, trying to find ways to reduce the work hour. You know, people are working longer hours, and we're going to talk a little bit more about the challenges with integrating work and life and that personal time and trying to reserve some of that to help with burnout. But it is a real challenge. You know, more and more is placed on us in terms of demands and things that need to get done, and we're taking work home, and we're working in bed until we fall asleep. So that is something definitely that we have to look at, and that could very well be part of having a discussion with leadership, but also with people who are doing the work that the leaders are trying to have implemented as well.
Can I just add
Yes,
one thing to
please.
that, Wanda? One thing that I've been convicted about personally as a leader is that when I send an email at midnight to my associates, they feel pressure to respond to that. So me being very mindful of not sending sometimes I do to my peers. If, you know, Gayatri could get an email from me, but she doesn't have to respond. But the people who report to you, without saying anything, that implicit pressure, my boss sent me an email, I need to look at it and respond. And so if I want to help them create a mental break from their workload, I cannot send them emails, phone calls, text messages after hours on the weekends. Like I desire for them to be able to mentally unplug, and I know how hard that is for me. So I need to foster that and model those good boundaries, especially to the people who report to me. So that is something I'm mindful of, got convicted about, and have worked very hard to try to address. Just because I'm up and bothered at midnight doesn't mean I need to send that down. I need to catch that as a leader and hold on to that and do what I need to do to manage my own stuff without passing that on to the people who report to me.
And why don't we stay on this topic and talk even more about how do we help to foster that balance between work and home life? So you talked about one tip that you use, which is really good. I would say one of the things that I find that has been important and has helped me is to really consider and think about my own personal values and try to keep those values before me. to really think about, okay, what's important to me, really? What's most important to me? And that helps me to stay on track a little bit more. It helps me to be able to say no to some things because family is important to me. If there's a family matter or just a ball game or, just some event that's casual that I'm committed to or I'm wanting to be there for my family member, then there are things that I've learned to say no to. So for me, just being able to think about and keep my values before me, I find that quite helpful. Any other tips or strategies that you use?
Well, I love that. I think knowing what matters to you helps you stay fueled for all the things on your plate. So I love that. I have physical reminders, like the end of my day, I take my badge off and I put it in my bag, and so that part is done, and this part is starting now, right? Like I take the badge off and I put on the mom hat, even though I don't actually have a mom hat, but you know what I mean. So that's a physical reminder, but I also think it's really important to, in addition to values, just know what it is that, what is the why of the work that you do. And being able to trust your colleagues, and I think trust in a team, whether that is people you manage or people above you or your peers, being able to trust your colleagues then helps me know when I leave, someone else picks this up. When I'm not there and when I'm recharging myself or on vacation or away for a reason, I have a colleague who cares about this just as much as I do and who is just as capable of doing the great work that I would do, or that I think I would do, I hope I would do, they can as well. And so I think fostering that in your team, I love that you think about when you send emails, because modeling as a leader is huge, right? And so if the expectation is that I'm gonna send an email at midnight and someone should respond, being able to model, well, no, I'm not going to ask you to do something after 6 or whatever the time is, or on the weekend. When you're away, I want you to put an out of office email message up so that people know you're away, and it's okay to respond to messages when you come back. So a lot of modeling, a lot of physical reminders for myself, and then just knowing that I'm part of a huge system, I'm part of a huge group of people, whether I have a colleague who's a dog and is really not good at responding at emails, or if I have really accomplished peers, I can trust my team to continue doing things even when I'm not there.
Great. Thank you.
That's great.
And I will say, just piggybacking on the emails, I have received emails where a person just in their signature line will have a statement added to it about, these are my work hours, they may not be your work hours. Do not feel pressured to respond if this is not within your work hours. So even something like that could be.
I just don't want them to have to read it outside them. So I think, no, I've never told anybody if I send you an email, you should respond at midnight. But I think it doesn't even have to be said. It's this implicit pressure to read the email, to think about the work. It's mentally, if they are sitting at the dinner table with their kids, it pulls them away for a minute. And so I think it's just, in our tech world where we are accessible 24/7, that's not good for us. We are always reachable now. It used to be that we could go home from work, but you can't do that anymore. Work follows you unless you're really clear with boundaries for yourself. And then as a leader, I think about we need to help set some of those for our people. So yeah, I like the email signature line, but it's better to not send the email. So they don't even have to think about you.
Oh, there's even delay send. You can schedule
You can schedule it, which is cool.
Yeah.
Yay, technology.
Sometimes it does help.
It does, yeah.
Right. Okay. Well, let's talk a little bit about some initiatives that may be going on in your organization to help support resiliency, and also that will help support professional well-being. And I'll start with the organization where I work here. I guess last year they started to focus on pillars of health and increasing the awareness of it. And as an organization-wide, we started participating in various activities. So for example, one of the pillars of health is physical activity. And so during a month, there was videos that were created and placed on the organizational's website for the employees. And everyone was challenged to add the STEP app to their phone and keep counts of their steps. And there was this whole contest, and they would weekly, I believe, post the top 10 steppers in the organization. And it was so interesting just to walk through the clinics and have people say, hey, how many steps you have? You need to pick it up. Come on, let's do more. But it was really encouraging. I mean, and I tend to exercise on somewhat of a regular basis, but during that time, I was stepping even more. I was watching my watch going, okay, I need more steps. I hadn't hit my mark today. So that's something that they've done and was really fun and helpful. And then another month, one of the other pillars of health is nutrition. And so they had a month where they encouraged employees to post healthy meals. And again, fun. People are thinking about preparing these meals. They're taking pictures. They're posting the pictures on the site. They're getting feedback from it. So that was a lot of fun. Currently, given that this is March Madness, we, participate in the brackets, and 100% participation is required at the clinic where I am. It is so much fun. All the brackets are placed on the wall, and every day everybody's just going to the wall, talking about basketball. It really does help to just kind of bring the stress level down some. It gives just some friendly conversations and friendly competition for people to talk about, and just kind of brings them together in that way. So those are just a few recent changes that have been implemented at the clinics where I work, and it's been pretty fun, I must say. Definitely, I think, supportive of the staff's emotional well-being as well as their physical well-being. So anything in particular going on at Methodist you want to share about? Or
so Methodist is helping the whole community. They're working to support the whole community with the Healthier 901 initiative. And so really driving towards getting the Mid-South thinking about health. And one thing I noticed and was delighted in is that once we launched this initiative, our staff meals and events all started getting healthier. Like our options for food got healthier, which was less fried chicken, less barbecue, more salads. So that was a delightful improvement, I think, from our administration for staff. But Methodist offers the EAP program with 10 free sessions. They do have access to the Headspace app where you can connect and receive counseling and tech support. Additionally, one thing that I really appreciate is with our insurance for all staff who are on our Methodist insurance, if you want to go see a therapist outpatient and they're in network, it's a zero copay. So that I think really helps. You can go anywhere. You do not have to go to EAP. You can see any therapist in our network and you don't pay anything. So I think that really promotes people having the opportunity to seek care with less barriers for them. So that's one thing that I really do appreciate. We also, through our med staff, offer physician well-being counsel opportunity, and physicians, and it's anybody who's credentialed with med staff, so that can be our mid-levels as well. They're encouraged if they're struggling to seek that support, and that's in partnership with the Tennessee Medical Foundation. They do get extra counseling and extra support, which is nice. And so I think that's certainly an opportunity that our medical staff have as well to get some extra help.
So we have a number of different programs at St. Jude that, again, my sole role is supporting staff. And so in addition to EAP and connecting people to those kind of benefits, we also really try to do both proactive and reactive support. So we try to educate people, we try to be really available to people. And I think it's paid off for us to just normalize the experience and normalize reaching out. So with our dog, Rosalie, we have social hours every month. I always try to remind people they're not happy hours, but they're social hours with our dog. And not everyone is a dog person, and so we also just try to round proactively, both during the day and then also nights and weekends, to see maybe staff that feel a little bit less seen if they don't work during the business time frame. We also have mindfulness drop-in opportunities twice a week, so virtual opportunities for staff to engage in mindfulness. Again, wanting to make things really accessible and approachable and maybe a little bit less scary for people to reach out. We have a resilience retreat that we're launching to help give people the experience of, okay, what does it mean to be mindful? What does it mean to do physical activities or a body scan, or talk about my physical health in addition to what I put in my body and what I think and what I feel. We also are launching some coaching that is going to be accessible to our staff. We have on-site counselors so that people don't even have to leave the facility to meet with a mental health professional. So we really try to implement things and strategies that help people really have quick access to things when they need it. We offer debriefs if something happens in an area, whether it's related to a patient or not. You know, things happen with your colleagues and your friends that you work with, and we can come in and provide that space to talk and process as a group. So we can do that as well. And I think that all of our programs, we really try to be relevant and evaluate our programs. Is this meeting a need? Is this something that you want? Is this something that is helpful? Because if it's not, then what can we do to better meet your needs? And we have initiatives that we do every year, an annual resilience initiative. I love your focus on the different pillars of health. We've done a number of different things, from a photo mosaic where people sent in pictures of what matters to them and then put it together in a really beautiful image that hopefully conveys the message that you matter as an individual and you also matter to this institution in a grand way. We've also done 3 Good Things as an initiative, Random Acts of Kindness, what brings you joy in work. So all of these ways that we can keep resilience and well-being forefront, make it a part of the conversation so that it doesn't become something that we just tack on later on, but really is part of the conversation all the time.
And I love the fact when you mentioned about normalizing so much of mental health and talks about mental illness, whether it's an illness or not, even just the stress and the burnout. For so many, there's that fear. You know, there is not the psychological safety there. Many don't feel as though, you know, I can say something. I'm afraid that maybe my license may be, you know, in trouble or possibly revoked. So being able to work towards normalizing these areas, it's really important because, as it's been said already, we're all humans and we cannot act as if nothing affects us and that we're not impacted by anything. We can't pretend that we don't have emotions, and sometimes those emotions are that of sadness or pain or hurt or disappointment. So I think being able to normalize these conversations and what we do there is very important. I have something that I would like to share with the group that I came across in the literature, and as you were talking about those various areas of supports and the EAP and the counseling and the coaching, I want to share this review of evidence-based interventions. And these researchers found that at least 90% of the interventions targeted to address mental health needs of healthcare workers, they were found to be effective. So they put them into 7 categories, and I'll just read the list of these categories, and you will hear some of these have already been talked about, which is wonderful. But one category, and they're not in any particular order, is coping skills development. So doing things like resilience training, for example. Another area that they found very helpful is mindfulness, and I wish Jamie was here to talk about that. Then health literacy and anti-stigma, including mental health awareness and stigma reduction. So that could be done in a training, for example, like mental health first aid. The fourth one is peer support. So really looking at team building, also looking at relationship building within the organization. They listed organizational and system level changes such as policy changes and cultural change as being effective. Reflection and relaxation, coming and spending time with the dog, right? And they also talked about artistic exercises. You mentioned that mosaic there. And then the last one was just medical, including medication when people have been found to need that. And so, and sometimes there were multiple interventions going on at the same time because some of these really cover more than one area. But again, it was bound to reduce stress, anxiety, emotional exhaustion, compassion fatigue, burnout, and depression. And I think it's important for us sometimes to get creative, you know? I think that's really important.
And I think I'm so glad that you cited that because sometimes this work is seen as soft science, right? Mindfulness, breathing, blah, blah, blah. But it actually does work. And I think, too, it's important to say that we don't have it all figured out yet. And I'm going to go on a limb and say you don't either, right? This is hard work, and it's important to continue looking at and continue doing and continue to strive to do more because we don't have it all figured out yet. People continue to have needs. They continue to change. Our environment around us continues to change. We encounter things all the time we never thought we would. So it's important to be responsive and to listen and to adapt and to try new things. I remind people all the time working in medicine changes all the time. We don't treat things the way we treat them today because it's what we did 20 years ago, right? We grow, we develop, we have new technologies, new strategies, new medicines all the time, and we're willing to try new things. But yet when it comes to our resilience and our mental health, sometimes we don't. And so if we're willing to try new things as we grow in medicine, let's try new things for ourselves too, because oftentimes they are effective.
Right. Yeah, and it's been proven. Yeah. But what are some things that get in the way? You know, this was a beautiful list, right? Just lovely, all kinds of activities and strategies that have been found to be effective. But let's spend a few minutes talking about what often gets in the way of an organization or gets in the way of a leader being able to implement some of these strategies. And I know where I am, cost, you know, is probably, I guess, the most pronounced factor. It's a huge factor, and it often keeps us from being able to implement programs to the extent that we would like and be able to put some of these things into place. Is cost a barrier for you too as well? Yeah. Any others that come to your mind?
Time. You know, I think about we're so busy meeting metrics, meeting marks, new requirements that are piled on by the payers and by all those things. And then, you know, the patient needs are growing and changing, you know, since COVID. And I think it really came to mind for many of our providers that the mental health comorbidities that exist with the physical health issues that they're so used to treating, but it just got exacerbated in COVID. And, you know, one doctor said it really just kind of pulled the blanket over my eyes that these problems existed all along, but I didn't notice them as much as I did during COVID. And now I think they're seeing it more. Tensions in our world are high. People are more stressed out. That didn't go away with the masking requirement dropping. It's not just COVID, it's all the things now. And so the stress of our patients and the acuity of the patients, I think, is weighing heavy on our medical teams. So the time needed in the room is extended. The burdens of requirements and documentation are increased. And so I think a lot of times I hear from staff and providers, when would I have time to care for myself? And I think some of the programs that we have implemented in the past, when I've talked to HR, you know, why did this program go away or that program go away? Well, it wasn't utilized. Why? Because they don't have time. So, I think money, time, and really maybe making that a priority for ourselves, to care for ourselves well. I think all of those things are barriers, but eventually do land us in burnout. So making sure we're looking at all of that as a system level, as administrators, how do we carve out time? How do we discuss this as a priority, not just something we tack on at the end of your performance eval? All of that's important.
And I would also say, it's so nice to have a list of strategies of things that can help, but this is not an easy task, right? We are multifaceted people, and so someone's work life bleeds into their personal life, or their community bleeds into their professional life, right? So there are all these pieces of who we are that come together. So work may be going great, and everything is wonderful, but I'm caring for an elderly parent who is struggling and doing, really poorly. And then I also have young children that I'm caring for, or I'm worried about, the election coming up, or things overseas, right? So one facet of our life is just that. It's one piece of who we are. And so I think this complex puzzle of who we are means that we have to have a lot of different strategies and understanding, because it's not an easy fix. If it was, we wouldn't be having this panel discussion, right? And so it's multifaceted as well.
And really almost needs to be individualized.
Mm-hmm.
I have a colleague who leads a provider wellness program at a large health system somewhere else in the South. I won't name the name, but they're doing phenomenal work. And he is leading the charge. He's a psychologist by training, but was asked by the health system basically to design a program for provider wellness. And I met with him because I wanted to just pick his brain, because I feel like we could use more. And one of the things that he has created that I thought was really helpful, I liked that you mentioned, appreciated that you mentioned, some of the providers even worry about, if I go seek help at Headspace or EAP or another provider, what happens to my license? I heard it yesterday in one of our practices. A physician grabbed me and said, I have a patient who's a physician at St. Jude, and they're terrified, that they're anxious, they've got a lot of stuff going on, and they're terrified if they seek help that the Tennessee Medical Association will find out and take their license. It's not true. Some of it is miseducation of our providers and our team members, that we need to assure them they're okay. But one of the things that this other health system did to kind of circumvent that is they created a very safe coaching program. It is not counseling, and they can come and get coaching that is documented nowhere, and if a mental health need is detected, they can be referred out, but they don't have to come in under those auspices. They can just come under, I need some coaching. And so a lot of times the medical providers are more comfortable coming in for a few sessions of that, knowing there's no documentation, there's no diagnosis, there's nothing going to insurance. So coming up with some innovative words matter. And so when we say counseling or therapy, that triggers a lot of things for our team members. So what about something like that? And he is paid by his health system to provide the coaching, so no bills are going out, but the system is investing in their providers because they know it matters. And they're allocating a portion of his FTE to be able to offer this coaching. So I thought that was a wonderful, innovative program to kind of address that.
And I read something somewhere, this is really creative, and I'm not quite sure how this is being done, but there is discussion in the literature about billing for self-care and actually allowing everyone to have time during work, for self-care, and being able to build that.
I don't know how that's going to
I
happen.
don't know. But I came
great
across that
idea.
in the literature. I was like, wow, that's really interesting. Yeah. I know we're coming to the close of the time that we've allotted for the panel discussion. So I'll ask Scott if he wants to come and see if there are questions from the audience.
Thank you all so much for your discussion. This has been really good. I've really enjoyed this. I'm going to take the opportunity, since I'm here and have the microphone, I'll ask the first question. So a little personal background here. So in March of 2020, my department was told that we had the opportunity / mandate to work from home. We've not gone back. My office is adjoining to my bedroom, and most of the day I am within 20 feet of my bed. I see my dog, love my dog, but I don't see anybody else except through a screen. So that's been difficult for me to get used to. I'm naturally I like to be around people. When I was a Baptist, I worked at Baptist for a while, and there were some stressful times, and one of the things I found was, as I left the building, I always touched the same tree and just left my worries with that tree, and that was really helpful.
I love that.
My question is, what are some things that you have found in your personal life that have been effective for you in dealing with difficult times like that?
Like having to work from home, or just in general?
Just in general, just stressors that you encounter. What are some things that work for you?
I'll start. For me, I just have to go back to my values. It's important for me to be well rested and to be healthy. And so there are times when I may stay up a little late to try to work on a project or so, but I'm always looking, or at least mindful of the time, right? And knowing that there's a certain cutoff time that I got to go to sleep. I just don't function well without, proper rest. So really, for me, thinking about those values and keeping those in front of me, and then also being sure that I'm spending time doing some things that I really love. That I'm spending time with family, that I have time to serve the community or to work through my church, just to be sure that I'm having, for me, what would be a good balance. So I just try to keep that in mind for sure.
Thank you.
Just to be well.
I'd echo my colleague Wanda as well. I think the values piece is huge, and I notice for myself, when I get off course from that, I feel off kilter. So things that have, I know, consistently been really good for me in my life. Exercise is huge. When I'm regularly exercising, my mind does much better. When I'm not, my anxiety goes up. My feeling of the stress is greater. I'm better able to manage not just stress from work, but when my kids are misbehaving. If I have gotten in at least some sort of physical movement and activity, even better if it's outdoors. Being out in the sunshine, the vitamin D kicks in, it activates your serotonin. So there's lots of things that happen being outside that I think nature is really good. Having a mindfulness practice is important to me, as well as for me, a faith-based prayer practice and scripture study has been something that's been a core piece of who I am. So family, fitness, faith, those have kind of been the three things that when I'm doing those things, I can handle just about anything. And when I'm not, the stress can feel a lot harder.
For me, I would say I am an external processor. And so my husband, bless him, sometimes he's not always available. And so I just might need to write a whole lot of things down and just get it outside of my own head. And for me, that can be, a prayerful time that I get it out, or it can be a really stressful time that I crumple it up and throw it away, right? I just have to get it outside of my own head. And so I might talk with someone about it, but it's also really helpful for me just to write it out sometimes. And then I can see what I wrote, and maybe that becomes a reflective practice. And I go, well, maybe that's not exactly true, or maybe I don't really feel that way. But sometimes I go, yeah, I do feel that way, and now that's over there, and I can continue doing this over here. So that's one practice that I do when I start to feel the tensions inside get a little high. I just need to expunge it out a little bit.
I like that.
Great, thank you so much.
One more thing I'll add, I think just having a friend at work, one friend at work, people who have a friend at work are happier. That's just, a real friend. One that you'll ask, how's your weekend, and care to hear. One that you'd maybe go out to dinner with at some point. So having a real friend at work. So I think when you're working remotely, that's really hard because the dog's great, but it's not the same thing. being intentional and finding time to connect with colleagues in a meaningful way, not just about work, can just make your environment so much better. So I really encourage, especially new staff, ask someone who you think is kind of cool at work to have lunch with you and make a friend, because you will enjoy your day so much more. And so I think that's just something to be aware of and try to cultivate in our staff too.
And isolation is, it's real, right? And we saw this a lot when people did go home to start working. And even though some have gone back, I think that's another area in which organizations can really look at and try to become creative. How do we really work to include the people who are working from home so that they can feel as though they are still part of the team, that they're still valued, and we could still try to build those relationships.
Relationships, just, that's key.
It is.
You don't feel isolated when you feel like you're in a relationship with people. That's great. So I will relinquish my monopoly here. What other questions do we have?
No, I don't have a question, but I have a comment on the question that Scott had. So when COVID hit, my brother was working for New York Times, and everybody was, it's New York, everybody was working virtual for everything. And the Times then came out with a virtual happy hour because they started feeling that the isolation that people had, just being in their homes, in their silos. I mean, you couldn't even take that walk out in the open, right? We were literally jailed at home, more so in that part of the country. And so they started having these virtual happy hours. Then COVID went away, but it's cheaper to keep people at home than bring them back with the real estate in New York. So they continued with this concept of a virtual happy hour so that people could continue staying in touch and be connected. So my brother used to speak very positively about it because we, as social beings, we crave that. And when we don't have that in a physical workspace, they got creative with creating that virtually.
That's wonderful. We have a couple of team members who are fully remote. I have an LCSW that lives in Indiana, and I have a psychiatrist in Pennsylvania. And so for our Christmas party this year, holiday party, we had it locally in Memphis, but we actually set up screens for them to participate. And it was, we took our team photo with them in the background with their cheesy Christmas sweater and everything. And I think it was really important for us to do that. We are regularly active every day on Teams chat. And of course there's work things, but my team members are embedded in medical practices all around the area, and so we don't see each other in person very often. So in a way, we're kind of all functioning on islands unless we have some sort of regular communication. And we do have meetings virtual mostly because it's cheaper and easier to do that than have everybody drive in and take an hour off to commute. But we're pretty intentional. You know, Monday mornings there's always, how was your weekend? Let's post a favorite photo from your weekend. And so sometimes it's a dog, a kid won a medal at a track meet, but like we want people to share those things to connect. And then we have one wonderful team member who consistently shares a joke or two of the week. And we actually get those several times a week. And so we've started kind of trying to one-up each other with the jokes. But I think that just creates for people spread out, even if you're not fully working remotely, if you have team members across a large health system, it can be challenging to have that sense of connection, leading to that sense of isolation, lack of team. And so I think being very intentional with that, how can we connect as humans over a happy hour or with jokes or sharing things from our weekend? I think we do need to be mindful. How do we connect with our people as leaders?
Yeah, Laura, and I think as you mentioned, the remote meetings, you don't have to be working remotely.
Right.
Our meetings are so remote now. I
Most of them.
used to enjoy meeting with Richard's team regularly on site at Crosstown, and I do that virtually now, and it's great. I love doing that, but it doesn't replace that personal interaction.
It doesn't fill the cup in the same way. So really, prioritizing at least occasional. Today, I was very fortunate. We had a giant event at Methodist, and there were 750 colleagues in a room, and just hugging and shaking hands was really meaningful and important. So I think when we can, even with our remote teams, as much as we can, trying to gather people together, at least on occasion, is important as well.
Yeah.
What other questions, thoughts that we have?
I have another comment.
You have to wait.
Shut down. She's the only one with a question.
No, it really was in response to a question that the panel discussed on what are organizations doing. So I don't know if this exists in other organizations in our city, but at Methodist we do something called the Associate Feedback Survey. And I think about 2-3 years ago, we created a section called Resilience Section. It's a bunch of questions, about 6 or 7 questions that are intentional. It's a confidential survey that every associate at Methodist takes at every level. It's confidential, so the organization really doesn't know who is giving what response. It's a whole bunch of different domains. A lot of it is really about how we are caring for our patients and how we are doing as a team and what our service indicators are for our patients. But there's a whole section on burnout that the programs that we have at our organization, it requires intention for a person to seek it out sometimes. But I thought that the resilience section is a beautiful way for every associate to provide their feedback without seeking it out, because everybody's not comfortable doing that for the various barriers that we discussed. And we actually get scores on that as leaders we are able to use for ourselves, because we take the survey too, but also what our team feels in terms of burnout, and what are those opportunities that we have as leaders to help our team mitigate some of the issues that they are identifying that they may not tell you, but they are telling you through that survey. So it's just another thing that we do at Methodist.
That's a wonderful add. Some of the questions are, I looked at this recently in our AFS feedback, but I rarely leave sleep over work. I'm able to separate myself from my work. So those sorts of questions to really drive at that. And then actually during COVID, one thing that Methodist did that I really appreciated, and I haven't seen in a while, but they used to send out these well-being indexes to your email, and it was really, you could take it or not. It was fully anonymous, and honestly the feedback was just for you, but it was an opportunity for you to check in and answer some questions and then compare you to you at various points. So you could see, gosh, I'm doing better than April of 2020, but I'm still not really doing well. And then there was a link to suggested resources. So I think that was a lovely thing that we did for our team members and for ourselves, to occasionally just give us the opportunity to do a check and see how we're doing.
Yeah, and in our annual surveys as well at St. Jude, we have questions related to burnout to keep a pulse on it. And then VA has a great app too, so that people can have that information for themselves, over time. How am I doing? How was I doing? And help recognize their own patterns, right? And their own predictive factors, so that they can intervene and, I'm moving in a direction I don't like to go. What do I need to do with intention? What do I need to do more of, do less of to address this?
Thank you, Gayatri.
I am done, Scott.
No.
Questions?
Always have good things to say.
Thanks for your engagement.
Thank you. Got time for one more question. Worth thought.
I just want to share one thing. That one time back when I was working at Methodist South, they actually created, like a stairway to health, which it was like 6 stories staircase, and we would have like murals and there would be like statements written on different floors saying that, hey, I remember if you climb to 6th floor 300 times, you reach the top of the Mount Everest, or something like that. And they were like, there was music going on, so encouraging people to take those stairs.
I love it.
And actually, there was we were like how many people are using it as well. So
great.
That's lovely.
How do you used to get the stairways against regulations? You can-
There you go.
Thank you, Richard.
I'm sure it's not going anymore.
Well, thank you all so much for coming tonight, and thank you especially to you ladies for coming and sharing your thoughts with us, giving us some great ideas and things to think about. One thing that I do want to remind, if you did not get a chance to sign in and you're a member of ACHE, oh, thank you, Carl. We want to make sure we get your signatures so that you can get your face-to-face credits. I want to make sure that that we don't miss anybody on that. Our next event will be April 18th.